Now today we're going to talk about good old Mr. and Mrs. Disc. Bulge, herniation, rupture, fragmentation. What all those terms mean, we're going to go over that today, as well as give you some treatment ideas to help reduce your disc issue. Stay tuned, here we go. All right, let's talk about the disc. Now, it's gelatinous type filling, and it essentially gives the cushion or support between the bones of your spine. So this being the front, and this being the back, this being the spinal cord, and then these little things off to the sides being the nerves that can get irritated. So if you're having a disc issue, it's usually gonna be on the back and outside. So whether it's pushing back or back and to the side, you're gonna get some irritation in the nerve on either side of the body. Now, the idea years ago was that the disc is somehow gonna push out and come back in. Well, the reality is once it's kind of pushed out, it leaks, it gives off some, what we call inflammatory chemicals that gets that nerve on the inside really irritated. And so what you wanna do is initially put yourself in a nice rested position that we'll go over. Stay tuned for that. As well as some of the exercises I'm gonna point up above. After the inflammation starts to reduce after 2 or 3 days, I'm going to give you a little link above that you can look at that can give you some idea of some of those muscles that can go into spasm and get irritated after the disc has caused some of the issue in the first place. So that's a little tidbit for you. After you're done with this video, you can go look at that one. Now, this disc itself, as it starts to bulge out, basically there's nerve endings only on the outside. The disc itself does not have any nerve endings. So you could have multiple tears within the ring of the disc and not have any symptoms because there's no nerves there until it gets and starts to push out on what we call the peripheral nerve, or out to the side, one of these side nerves that comes out from the spinal cord. And then you're gonna have an issue. That's, at that point, it's a herniation. As I talked in the very beginning, you can have that bulge which just pushes out. It might touch the nerve, it might not. The herniation is gonna touch the nerve. And then we're dealing with a rupture where some of the disc that has the fluid itself is leaked out into the space, into where my finger's at, into the canal, and or it fragment. Basically a patient is broken off and it's just floating inside there. Any of those last two, if they give you an MRI, or an MRI with dye, which is called contrast, they're probably gonna have to do surgery to get that if it's fragmented out. But that not being the case, there's some treatment exercises you're gonna do at home to help reduce one of these 3 issues that we're talking about: the bulge, the herniation, and the rupture. Fragmentation, you're not gonna have probably physical therapy for that. You're probably gonna go right in for surgery to take that fragmentation out. But give you these 3 actual exercises you can do at home once you realize you're having some disc issues, which is usually pain down the side of the leg that passes the knee joint on either side. That's a clear case that you're having a bulge issue. So I'm gonna give you some exercises. Stay tuned. This is the most important part coming up. Be right back. Exercise number 1. The best position you can put yourself in is not sitting. The best position you can put yourself in is either lying on your side, lying on your back, or lying on your stomach for short periods of time to limit sitting position completely. So if you're lying on your stomach, which is very important, what you want to do is take a pillow, take some ice, put that right underneath the belly button, and throw the ice right over the top of the lower back and whatever side's bothering you. You're gonna lie in this position for a good 10, 15, 20 minutes, and you're gonna do that 3 or 4 times a day. Like I said, you're always limiting sitting. Sitting is the worst pressure that you can put on the disc, even if it's proper sitting. Now, proper sitting, you're gonna use good old magic towel. You've seen in my other videos, you just roll up a piece of either a rag, or I don't want anything too thick, and you're just gonna put some tape around it while it's rolled up, the magic towel. And essentially what you're doing is, when you're sitting away from the slump. You're coming up nice and tall, Then you're gonna put that towel roll down at the tailbone so it blocks you from rolling down. First is doing more lying on your stomach, staying out of that, what I call letter C of the spine. If you take the pillow out and just lie in your stomach, come up on your elbows. If you hold that position for about 10 to 15 seconds, then come down, relax. Now, this should basically make the symptoms, if you have any leg symptoms, should make them reduce. So those are some good exercises that you can do to help reduce your disc symptoms in your leg. Now, you should notice a difference by doing these 3 to 4 days. Each day, your leg symptoms should be getting better and better. Leave some comments down below. If you have any questions, like I always say, if you like the content, I'd love to have you subscribe and ring the call bell down below so you can see my upcoming videos. I'm going to be making a few over the next few days since I was on vacation. And next time, I want you to look up and keep smiling.